Welcome to today's Society program with me, Florence Lowenbu. I'm here with Dr. Tomoko Kurokawa, who is the Deputy Director and Deputy Representative of UNFPA. So, could you say a little bit about what is PSRH?
Sure. The PSRH stands for the Pacific Society for Reproductive Health, and this is the 12th conference for PSRH, which is being held in Port Vila this year. It usually rotates among the Pacific countries, and actually it's done one full circle and has come back to Vanuatu. The first conference was held here in Vanuatu, and it's come full circle, and this week, in fact today, this morning, we just launched the 12th conference back in its original location.
So what are the purpose of these conferences?
The purpose of the conference is to bring reproductive health practitioners and stakeholders from all of the different Pacific Island countries to share information, to learn more techniques, and to advance more education so the practitioners and healthcare providers have more skills to provide better quality sexual and reproductive health for people in the Pacific.
So for the past year, what are the outcomes of the conferences?
The conference is a gathering of obstetricians, gynecologists, midwives, nurses, and all other people who are involved in delivering sexual and reproductive health in the Pacific. So, for example, some of the workshops that are being held right now are learning better ultrasound skills for obstetrics for pregnant mothers, advancing skills in something called colposcopy, which is a type of test to look for cervical cancer, because cervical cancer is actually very, very high in the Pacific region. Some of the scheduled meetings are also around discussions on family planning. So how to use more effective contraceptives and how to make them more available. And also some of the nurse practitioners will learn to advance their skills in delivering some of the more invasive types of contraceptives, for example, injectable contraceptives and implantable contraceptives. So it's a very comprehensive conference that covers everything that pertains to sexual and reproductive health.
So how effective are these conferences in pushing forward the importance of reproductive health?
It's actually one of the most important venues because it brings so many people from all the different Pacific Island countries together. It's very rare to have this type of venue where so many people can gather in one place at the same time, and not just to learn more skills and to get updated on what are the recent advances in research, but also just to share information, to learn lessons from each country and each practice. So, for example, the Solomon Islands recently had really good success in uptaking a type of contraceptive called Jadel. It's a contraceptive that you actually implant under the skin. It's very effective and safe. And this is relatively new. This is a new concept for women to seek something that's a little bit more invasive but very effective. So the Solomon Islands group is actually going to be presenting their success story, and hopefully that will stimulate a dialogue among other countries to perhaps adopt a similar case.
So what is the current status of Vanuatu in terms of reproductive health?
Actually, not just Vanuatu, but in many of the Pacific Island countries, there's an alarmingly high and increasing rate of teen pregnancy, and there's actually a very low rate of people using contraceptives, even though we realize that there are many people who want to use contraceptives. There are many women and girls who want to avoid pregnancy and who want to use safe and effective means of preventing pregnancy, but for some reason there is a very low rate of use. And that could be because there's no access, maybe they don't know where to go, Maybe they don't know how to use the different types of contraceptives, and maybe they're afraid of side effects. So again, part of the conference is to share information from all the different Pacific Island countries to understand what are the barriers, what can we do better, how can we tailor our program so we can make it more accessible for people to understand the different types of contraceptives and how to access them.
What are some of the developments that arise from in Vanuatu that arise from the conference?
I think here in Vanuatu, some of the key speakers and presenters here in Vanuatu are obstetricians and gynecologists who have a lot of experience in research, and they are really the key leaders who can share information and who can influence policy regarding sexual reproductive health. Again, knowing what is good in practice is one thing, but sharing that information and influencing policy at the national level is what ultimately we strive to achieve, because it needs to come from the top. We need to change the way that policies are shaped and how that influences what the practice is in the clinics and around the health providers across the country. So this is really an important forum for Vanuatu as well, especially because this is the host country this year.
So for this year's Population Day, the theme was family planning. So what does it mean to say that family planning is a cost-effective development investment?
Sure. Yes, this year's World Population Day theme is family planning. Again, like I just talked about, there are so many women and girls who want to avoid pregnancy because, especially here in the Pacific, there's a really high rate of teen pregnancy. When people become pregnant unexpectedly, when they did not desire the pregnancy, especially when teenage girls become pregnant, some of them may seek unsafe abortions, and that can lead to even death. A lot of people can get sick if they're not seeking the right healthy means to terminating pregnancies. And also, when people become pregnant when they did not want to, it can actually cause different risks to their health during the pregnancy and during labor, and it can even cause problems for the child. There may be premature delivery of the child. So even at the mother's level and at the child's level, there's a lot of risk to their health. So if you think about a condom or even the birth control pill or an injectable contraceptive, which can be very cheap, if that can avoid one unwanted pregnancy, and a condom can either be free or just a few, maybe even less than $1 or 1 baht, that can avoid a healthcare cost of thousands and thousands of dollars or baht to help cure disease or infection that may have occurred from an unsafe abortion. So again, that's where we're talking about how contraceptive is very cost effective. Preventing pregnancy, one pregnancy, can avoid so much, not just cost of caring for a sick mother, but it can also promote health. So it's not just about saving money, but it's about saving lives as well.
So what are the plans in place for reducing the number of teenage pregnancy?
It's very... Let's see, it has to happen at many different levels. It's not just about making condoms and different contraceptives available at healthcare provider services or at hospitals, clinics, maybe even schools, nightclubs, but it's also about education. It's about disseminating the proper education about safe use of effective contraceptive, not just for people who want to use it, but also for the community. Because I think one of the barriers for young people to use safe contraception is that they're afraid that their parents might find out. Maybe they're afraid of what people in the neighborhood might think if they find out. Maybe in the school, people talk about contraceptive, but maybe the right information is not being talked about. So there's a lot of fear of side effects, which may not even be true. So it's about, again, sharing the right information and also ensuring that access and use of safe contraceptive, it's actually a human right. It's every person's right to decide their future. That is a fundamental human right, and I think it's important for people to understand that.
Thank you, Thomas. Dr. Tomoko, for the information. Before we end the program, do you have anything else to say to those who are listening in to Radio Vanuatu?
Sure. Again, family planning, it's not just about being cost effective. It's not just about empowering people, but it's about saving lives. Using safe, effective contraceptive and being able to access family planning, it saves lives. And also it's about human rights. Every person should be able to decide their future, her future, his future, and it should be by choice. It shouldn't be just by chance.
Thank you, Thomas. Once again, Dr. Tomoko, for your time.
Thank you so much.